Please welcome the next presentation entitled The Added Value of Using Platelet Counts for Colorectal Cancer Screening in Primary Care Setting, presented by Mrs. Aunyamanee Petsiri.
Good morning, ladies and gentlemen. On behalf of our team from Medical Education Center, Phramongkutklao Hospital, faculties of Medicine, Sirindhorn University, my name is Aunyamanee Petsiri, a fourth-year medical student. Today, I would like to present our research project entitled The Added Value of Using Platelet Count for Colorectal Cancer Screening in Primary Care Settings. In Thailand, the incidence of colorectal cancer had increased in a recent year. Accurate screening is essential in primary care settings. Previous studies show adding the RDW or red blood cell distribution width to the routine screening is slightly increases the discriminative ability for colorectal cancer screening. And many studies found a strong association between colorectal cancer and platelet counts. Therefore, RDW and platelet counts may improve the ability for colorectal cancer screening. So, our study was to compare the area under ROC between the routine screening and different strategies using RDW and platelet count in suspected cases of colorectal cancer. This study is an added value screening research with contextual design. Data was collected during January 2021 to July 2022 in Phramongkutklao Hospital. We used dynamic sampling for control in our study. About 500 patients were divided into two groups. 90 patients for cases defined as patients who have confirmed colorectal cancer by pathologists. About 100 patients for control defined as patients who were not suggested for colorectal cancer. The routine screening determinants such as age, gender, smoking, family history of cancer, history of bowel habit change, and weight loss were collected from the hospital database. We assessed the association of screening determinant and colorectal cancer by multivariable logistic regression analysis. The different screening strategies added to the routine screening were compared using area under ROC with 95% confidence interval. And our study showed cases have more percentage of weight loss, about 52%, bowel habit change, about 85%, rectal bleeding, about 54% than that of control. In addition, the cases have more percent of RDW value and platelet counts higher than that of controls. You can see these figures show the discriminative abilities of screening model by area under ROCs. The orange lines represent the routine screening model for colorectal cancer, which show 82% of area under ROC. The blue line represents the routine screening model for colorectal cancer, added only platelet count determinant, which show 84% of area under ROC. And the last one, you can see the purple line represent the routine screening model added both of RDW and platelet count determinant, which show 84% of area under ROC. So, we concluded that considering platelet count to the routine test slightly gain the ability for colorectal cancer. This gain might not help clinicians in practice. In other words, the routine colorectal cancer screening is still potential for colorectal cancer screening in primary care settings. Thank you for your attention. If anyone has comments and questions, I will be pleased to answer them. Thank you.
Do you have any questions or comments from our judges?
Yes, as we all know that Thailand is the endemic area of thalassemia, and most of the patients with thalassemias have a wide RDW. So, did you have any method to overcome this limitation?
Okay. This study is an added value for screening of colorectal cancer. And previous studies show RDW association with colorectal cancer because colorectal cancer association with iron deficiency that increases the RDW. Yes, and the study I study from outcome to the determinant for exploration determinant with screening the colorectal cancer.
Related to Ajahn Piya's question, so I would like to ask you about because you mentioned about the high platelet count and high RDW. Did your results show about the anemia in the patient that high platelet count?
Yes, in our information, I give history taking about age, gender, history of cancer, and anemia too.
My question actually, because actually you answered that is correct because because colorectal cancer associated with the GI bleed, right? And the GI bleed is chronic. GI bleed is present with iron deficiency anemia. So my question is actually, so I would like to ask you correlate between the high platelet count and anemia and RDW. So in the group of the high platelet count, your patient also have anemia symptom or only high platelet count?
Both of high platelet count and patient who have anemia, the platelet count laboratory rising together. Yes.
Thank you so much for the presentation. Please give a round of applause. Thank you. Before the next presentation starts, it will be taken around 30 seconds.